now. As I say, my name's John Dickie, Director of Child Poverty Action Group in Scotland. Really pleased to be asked to chair this session looking at social security. Is it fit for purpose in the context of the pandemic? For us at CPAG, it's been absolutely clear that from our second tier welfare rights work and from our policy analysis, that the weaknesses in our social security system have become more apparent than ever, but also that the pandemic has highlighted the importance and the potential strength of social security as a mechanism for providing social protection, providing security to individuals and families from risk generally and from income shocks in particular. So very pleased to be here today, and that the focus of today's session is very much looking at all of us reflecting on how the system has responded, how the social security system has responded and coped at UK and at Scotland level, but also to discuss how the system, again at UK and Scotland level, can change in light of what we've learned from the pandemic and the experience of people of the social security system during the pandemic. Absolutely delighted to stimulate our discussion. We've got three excellent speakers. First up will be Russell Gunson, who's Director of IPPR Scotland, talking about what they've learned from the IPPR tracking of the impact of the pandemic and what's emerging from their Rethinking Social Security project. We'll then hear from Eilidh Dickson, Policy and Parliamentary Manager at Engender, who'll talk about the gendered impact of the pandemic, and in particular how women have experienced social security both before and through the current crisis. And then finally we'll hear from Ruth Patrick from the University of York, drawing on their COVID Realities project and very much on the lived experience of people who have been making use of the social security system over the last few months. We will hear from the three of them. They've got 15 minutes each, so I will ask them to try and keep to their 15 minutes to make sure we've got plenty of time for Q&A and discussion at the end, and that's when really we'll ask all of you to contribute. So really ask you to use the Q&A function as we're going along to start putting down questions. We'll hear from all the speakers first, but start putting down your questions as they come to you, and then we'll come to question and answer discussion once we've heard from the three speakers. Hope that all makes sense, and kick off by asking Russell to present to us.
Hi everyone, yeah, thank you ever so much for having me along today. As John says, I'm Director of IPPR Scotland. We're the Institute for Public Policy Research in Scotland, and we're a progressive think tank, so we are very much concerned about social justice and fairness, and how we can deliver a fairer and stronger Scotland. I'm going to assume, unless anyone tells me, that you can see my slides, so interrupt if you can't. What I want to talk through today is our perspective, so drawing on two main bits of work. So we've been doing a big programme looking at how we can rethink social security, looking very much at how people's finances have looked before the pandemic, how they've looked through the pandemic, and what we can do to improve them beyond. And then secondly, a bit of work which is more looking towards the Holyrood elections next year, called Better Than Before. And that's very much looking at the broader, you know, how do you rebuild Scotland in a way that sort of, I suppose, has social, economic and climate justice at its core. Which is very much in keeping, I think, with the theme of the conference today. So I'm going to talk you through where we were going into the pandemic, what some of the evidence going through it has looked like, and then some ideas for where we could go in the future. And on this slide, what I'm going to do is give you the short story, if you like, verbally, but the long story is there up for you to read, and of course for you to ask questions on both. The short story here, and this will be not news to any of you, but that poverty was rising and projected to rise to unprecedented levels even before the crisis hit. 1 million people in Scotland are in poverty. 1 in 4 children in Scotland are in poverty. And of course, that varies really significantly by background, family type, demographics. So lone parents, disabled families, people from Black and minority ethnic backgrounds, much more likely to be in poverty than others. And looking beyond poverty, looking at what we're calling financial insecurity. So, again, the health of people's finances, how they felt, and equally how resilient they might be to an income shock. Before COVID, we had big problems. So 1 in 10 households were struggling to pay essential bills, and that increased for larger families, the poorest and renters. And I think the one stat to take away from this slide is that 1.1 million, so 1 in 4 people in Scotland felt before the pandemic that they could cope for a month or less if they lost their main source of income. And of course, a few months later, after this survey was taken, we saw the pandemic hit and very much threaten people's income. So we went in this, if you like, running very hot. And in many ways, that's down to 10 years of austerity. That's down to welfare reforms, if that's the polite putting them. And also, of course, reductions in job quality. So we saw big increases in employment over those 10 years, but actually quality of work decreased, albeit, we shouldn't overstate that. We've seen a big response to the crisis, of course. I won't talk through all of this, but we've also seen an unprecedented crisis. I think that word, it felt like Brexit was unprecedented. It felt like lots of things were unprecedented before the pandemic, but this really is close to unprecedented. So we've never seen GDP drop by 1/5. Unemployment could reach unprecedented levels, particularly for young people. And so we've seen a big response, and I won't talk through all of these, but again, some of these, the furlough schemes, a temporary uplift of up to £20 a week on universal credit, housing support. Likewise, we've heard some of the responses from the Scottish Government that Eilidh talked through. But the vast majority of money has gone out to businesses through loans and grants from both the UK and Scottish Government, for good reasons, to try and protect jobs, but equally it does pale by comparison to the amount of money going out to families directly. And so looking through, if you like, that's before the crisis, looking through some of the evidence as to what's been happening through the crisis, what we find, and this will be no surprise, global pandemics are not the government's fault. They are horrible things on the health side, they're horrible things on the economic side, and sure enough, they have hit people's finances hard. I think the question that we'll come to is, whilst the pandemic isn't anyone's fault in particular, the response to it is the crucial thing, and has that been good enough or not? The one thing to take away from this slide is that those already struggling financially going into this crisis were twice as likely to face an income shock as those that were managing well prior to the crisis. And you can see in some of that real-time analysis, the groups of people hit hardest. So families with children, in the early part of the crisis, there was a survey that suggested, we did some analysis that suggested just under half of every single family in Scotland with a child was in financial difficulty. 1 in 5 of those were struggling to pay for food or essentials. You can see disabled people went into this struggling. You can see the gender dimension, which Eilidh will pick up much more, but parents, and particularly mothers, carers, particularly women, lone parents, particularly women, alongside other groups have been really exposed. And there's likely to be intersectionality. So, the idea that, if you come from a number of, if you have a number of experiences of poverty, they intersect, they compound. They're a different experience from just a sort of siloed approach to looking at this. Was the social security system fit for purpose before? And I think this is an obvious probably response. No, would be our perspective on it. We had huge delays to universal credit, inadequate levels of payments, cuts to benefits and entitlements, conditionality sanctions, the assessment regimes, a whole load of stuff that wasn't working well before the crisis. In Scotland, we were in the early stages of setting up our own system, at least to sit alongside the UK system, and very much prioritising a dignity and human rights-based approach. There were new payments that were supposed to be coming on pretty much as the pandemic hit that had to be delayed, or that were delayed at least. And the thing to keep an eye on is that much of the Scottish system is passported, so connected to the UK system. So you need to be in receipt of a UK benefit in order to access a Scottish benefit. That means they're linked, and of course, if one is failing, it may well drag the other one down. Looking at whether it's fit for purpose through the pandemic and now, we see some big gaps. So obviously there's a temporary uplift that was welcome, but it was small, and it's only temporary as things stand, so it's due to be removed at the end of March. There were some small changes to assessments and conditionality during the crisis, which were welcome, but some of them have been put back in again. Equally, there's gaps in support. So neither the UK government nor the Scottish government have provided help to families with children, despite them coming through really strongly as a group that's in trouble. And of course, we've seen delays. And I think, again, the crucial takeaway from this slide is that the Scottish government, at least, has used the local level to get a lot of its support out the door. So through the welfare funds, through the free school meal systems. So whilst having a dignity and human rights based approach at the Scottish-wide level is great, if you're using your local level in order to get money to people through the crisis for good reason, there's risks there that maybe the same approach isn't there. What can we do about that? But even if we were to fix those things that I mentioned, so even if the temporary uplift became permanent, even if we were to take the tweaks to assessments and sanctions and keep them, even if we were to plug some of the gaps that we've seen in the support and get that local level operating better, would we really have a social security system that was fit for purpose for the future? So in our view, we can aim higher than that. You know, these are really important steps. We must make them. But if we were to stop there, we wouldn't have got to where we want to get to. So to us, there's big questions, you know, how a social security system and beyond that, actually, a society really should be thinking about how we can get enough money into people's pockets, but also how we can make that money certain and reliable. It should be looking at how we can protect people from income shocks. In a way, the furlough scheme was necessary to be created overnight because there was such a huge gap in the social security system that we had to do that. In other countries, they had it in place or equivalents in place already. How can we get people? How can we help people with costs and ensure that everyone benefits from essentials to a good quality of life? So, you know, broadband, food, energy, travel. We've heard it already this morning. These are things that aren't seen as within the welfare state, but actually these are essential to people's lives. And maybe we should be rethinking where the welfare state stops. There's intra-household, if you like, so in-household risks and dynamics. So the fact that we assess people at the household level, we pay in the main one payment. We don't look at who's the primary carer. We don't split payments as easily. You know, again, that needs to be looked at. And then this last question: how do we tackle stigma? Why is it that we sort of define out some of the cash payments that go to dare I say it, middle class and more broadly people in Scotland as not being social security, and then define in other things as being social security? So, for example, nursery support. You know, everyone accesses it, but that's not social security. Student support, likewise. Why are we choosing to describe some things as social security and other things not? And does that add to a stigma that isn't helpful? And of course, the key point that we can't repeat too often is that tackling poverty goes beyond social security. You couldn't tax people enough. You couldn't pay people enough through social security. Even a universal basic income, or arguably, especially one, wouldn't tackle poverty. We can come on to that in Q&A. In the way that good work would, in a way that reshaping your economic model would, in a way that, again, drawing the boundaries of your welfare state in a different way would. And so for us, just to put some ideas out there in my last few minutes, what we're really interested in, if you're looking ahead to sort of 2030, 10 years away, and as Eilidh said this morning, you can't lose sight of the next steps, and I'll come to that in a second, because people are in crisis now. But if we are to look ahead to what could a much better form of social security or even welfare state for Scotland look like? And there's four sort of big questions for us. One is, should we consider a minimum income guarantee as a long-term aim? providing a real safety net. So a means tested, targeted support, yes, but one set at a level that people can live on, so the minimum income standard, and one without sanctions, one without conditionality beyond being in those circumstances. So a proper safety net that people can depend on and rely on. How do we get a fair work social contract? So how do we improve work in Scotland? And we've got some good ambitions in Scotland around that already, around fair work, but are we using the carrots and sticks that we have available to us to push that further and to force it, if you like? Thirdly, do we need to consider furlough-style income protection on an ongoing basis? So putting shock absorbers, if you like, into the system. So if people face an income shock, something's there to help them in a way that other countries have, in a way that we had to create in the middle of the pandemic, but maybe we should have had it in there already. And then lastly, and really importantly, should we consider a universal basic services approach? So this is that idea that the goods, the public goods, the things that make people have a good quality of life should be provided on a universal basis. Those services like broadband, like food, like energy, like travel, and of course, like all the things that are already universal, like health and education. And that could be, alongside those other 2 or 3 big ideas, a really good way to ensure that everybody has an access to a minimum, if not a really good quality of life in Scotland, in a way that potentially is affordable and more affordable than some of the other ideas out there that attempt to do the same. So what are the first steps? And I've got a minute or so left, so I won't talk through all of these. But it's really important that we don't get stuck at that high level. We can have a debate about UBI versus a minimum income guarantee versus whatever we wish to see in 10 years' time. But actually, all the while, Scotland's not burning, but there are things in huge crisis right now. And so what are the first steps towards those visions? So there are things we can do. We could put strings onto the business support, the billions of pounds of business support that's going out the door to drive fair work. We could level up wages for social care workers right now. We could provide that urgent help to families, whether through the UK or the Scottish Government, that's needed right now. And there's more we can do beyond that as we get past the election next year in order to make the progress towards those visions or those aims that I've outlined there. New progressive taxation and using our tax powers properly to change behaviours. And so if you may agree, you may disagree with some of this, but I suppose what we need is, of course, a diagnosis of the problem. I think we'd probably all be in the same place on that. A vision for the future, there may be competing ones. And then first steps towards that vision. We need all 3 of those, and I think from our point of view, we've set out what we think. But what's missing, I guess, and what we can't get past is public opinion. So how do we get voters to vote for this? And how do we get support from groups beyond the usual suspects like us, dare I say it? And I guess that's down to us, and I guess that's down to you in advance of the Holyrood election next year, which we shouldn't lose sight on. So I'll stop there. We'll take questions after, but really welcome the opportunity to speak today and really look forward to the discussion.
Thank you very much, Russell. Really helpful introduction and overview there to get us started. As Russell says, we'll be taking questions at the end, so do use the chat function to start posting your questions or thoughts, responses. But without further ado, I'll hand over to Eilidh, our next speaker. Eilidh.
Thank you. I'll just share my screen. I'll assume you can all see that one. Thank you very much. I'm going to give quite a whistle-stop tour through these slides, but if there's anything that obviously comes up in questions, I'd be really pleased to speak more specifically to some of the issues. I was asked to give a bit of an overview as to Engender's work throughout the pandemic, and I think it's fair to say the work we've done has covered every single policy area that Engender works on. So we are a feminist policy and advocacy organisation, and we work to make visible and respond to inequality between men and women. I think it's fair to say we were able to respond quite quickly. For some reason my slides are not going. we were able to respond quite quickly to understanding some of the areas that would be engaged by the pandemic. And we put out a briefing very, very quickly on the 26th of March, which gave a broad overview covering social security amongst health, decision-making, violence against women, the labour market. There were huge numbers of areas that we already had a huge amount of evidence about women's inequality on, that we knew were going to be affected in various ways by this pandemic before we ever had some of the policy responses Russell was mentioning before. As time's gone on, we've also done some work to develop principles for an economic recovery and get engaged with the advisory group on economic recovery established by the Scottish Government. We've sought to collect women's own experiences and qualitative stories about their experience of the pandemic, and they have matched very, very closely with one another. There's recurring themes that we can pull out from the written briefings we've been doing and women's own experiences, and they're very, very common. We've published a report into women and the unpaid work that's expanded during the pandemic as a result of lockdown and other public health measures. And we've also been quite closely engaged with the work of the Social Renewal Advisory Board established by the Scottish Government over the summer. So again, I'm going to start like Russell with a kind of pre-pandemic position. Women's poverty and economic inequality is informed by multiple different factors of inequality between men and women, but particularly I would just note the impact of men's violence, both domestic abuse but outside the home as well, on women's experience of the world, women's access to resources, both assets and money, but time crucially as well. Women generally have access to much less leisure time, much less time to work outside the home. The impact of gender stereotyping is still pervasive across the types of work that women do, and the ways in which they will behave and act at work, or the ways we assume that they will behave and act at work, and the gendered division of care, which I'm going to come on to in more detail here. But I just wanted to pull out kind of three strands to that financial insecurity point. And the first is that because women are twice as likely to rely on social security for some or all of their income, they are particularly affected by the design of social security and the ways that that maintains and pushes them into poverty. The benefit freeze is a prime example of that. That's affected far more women than men over the last 5 years. The two-child limit, crucially, the fact that we assume that women can make decisions about, or should even have to make decisions about, the size of their family, based on a kind of long-term guesstimation of how their economic circumstances will be throughout their lifetime, and the fact that the 5-week wait can have huge impacts for women who want to leave an abusive partner, for example. And I think I saw Marilyn Howard was here, so she might be able to say more on that a bit later. So the design is really contributing to keeping women poorer. I think I also just wanted to raise the fact that we know that the cuts to social security have affected women and men differently, but majority of them have come from women's purses over the last 10 years. There's also huge inequalities that persist within the labour market itself. So this undervaluation of the types of work that are still predominantly done by women, we call those the kind of the 5 C's, the cleaning, the clerical, the catering, the cashiering, and the childcare roles that women are still pushed into because of those stereotyping and occupational segregation things that I mentioned before. So those jobs are undervalued because they are done by women. It's not an accident. Women still are employed predominantly in kind of public administration, education and health roles, but have far less access to senior management positions than men do. So still 39% of manager level roles in those industries. Women are more likely, because they are in low paid roles and because of the care that they do, to be employed part-time, are more reliant on 0 hours contracts. And also women, as we know that 35% of universal credit claimants are in employment, but of those, 64% of those are women. So women are more likely to be utilising social security even when they're in work, and 2/3 of workers on less than the living wage are women. I could talk for hours about the kind of the persistent impact of care and gender norms and the ways in which we've become much more attuned to those over the pandemic because women have been so visibly in the home. But the social security system is really kind of focused on this idea of that work has to pay, and it privileges this really narrow idea of what work is. People leave the home, they go to an office, they make a thing, they deliver a service, and they come home, and it ignores the contribution that women are making to raising the next generation of workers, that kind of reproductive labour. Women are still more likely to provide unpaid care. Women are more likely to provide unpaid care and be poorer for it, so they make up the majority of those who receive carers allowance. And they're more likely to provide that sandwich care, so provide care for children and older and disabled relatives at the same time, which has huge impacts on their ability to stay in the labour market, either full-time or part-time as well. So before the crisis, I will just say that figure of 68% of housework and childcare was done by, was reached through time use surveys that were done in 2016. But this now has obviously changed quite significantly. And I mentioned the breadth of ways in which the pandemic has impacted women's lives. And this is just a tiny, tiny snapshot. And so many of these things interrelate to one another. Access to decision making, I think we forget how important that is sometimes, because in Scotland we had a female First Minister, we had a woman Chief Medical Officer, certainly at the start. But if you compare that to the governments around the world, women were really absent from the decisions about how we were going to respond to the pandemic. And academic studies looking into the responses to pandemics from years previously have shown that if we don't have representation of all minority groups or minoritized groups at the start of the decision-making process, our responses don't take into account any of their needs, because it's such a fast-moving situation. There isn't time to even do the kind of minimal engagement that we would normally see with policy responses. I think also it's vital that we don't think Scotland gets away with it because we have a female First Minister. If we drill down further, there was a serious lack of women making decisions in senior roles. The health service is a prime example. 77% of NHS Scotland's workforce is women, but 30% of NHS Health Scotland chiefs were women. So there was a big disparity between who was making decisions and who was enacting them. Isolation, I think we can all relate to, and that's not a problem that was solely about women, but there was particular aspects of the kind of mental health response to the crisis that affect women. Fawcett did some polling right at the start during the lockdown that showed that 57% of women were reporting feeling more anxious or more depressed compared to 40% of men. And when we look at some of the stories that women were reporting to us through our Women COVID Scot project, what really was bearing true is the impact of the additional work that women were having to do in the home, the more childcare, balancing that with their paid work or trying to maintain paid work, the financial insecurity. And because women are such a high proportion of those in frontline roles, 98% of workers who were in high-risk frontline roles, but also on poverty wages, there was a real sense of having to make a decision every day between going out to work and the actual health risk of the pandemic, which I think is not an unfair assumption. I think the figures are starting to show that there was an increased exposure for women because of increased reliance on public transport, women being more likely to be employed in hospital settings and education. So I'm not an epidemiologist, I don't have the kind of ongoing data for that, but certainly some of the early data is showing that women were more likely to report a diagnosis or more likely to report symptoms of COVID. The Alliance and GDA did some research over the summer that showed that social care had really struggled to adapt to increased demand and the impact of absences, and that had created an increased amount of unpaid care work for women to do. And we saw that as well with childcare, obviously, with children at home from school, the pause at the beginning to the expansion of funded childcare. That homeschooling childcare point is so gendered. The UN estimated that women were doing 2.6 times the amount of unpaid work as men were globally. But just that data, I think Russell was talking about, the IFS study, which looked at the impact of having children at home on mothers and fathers' capacity to remain in paid work during this time, showed that women were doing 2 hours less paid work than men were as a result of childcare, and that they were 50% more likely to be interrupted while they were trying to work. Domestic abuse, I think, is one of the things that the Scottish Government tried very quickly to respond to, and we had increased funds made available for violence against women organisations. But it's kind of well known now that women were able to access were less able to access services, that the kind of usual interactions with public services that might offer additional support, like schools and health services, were much more difficult to get access to, particularly in person. And the Scottish Women's Aid have now released some survey data which showed that local women's aid associations were reporting either increased requests for support, or that support fell in the early phase of lockdown and then increased again quite rapidly, and that there were difficulties in providing sufficient refuge accommodation or moving women out of refuges into other accommodation. And jobs, furlough has obviously done a huge amount to offer some protection on the edges of this crisis, but we know that women are more likely to be employed in sectors that are most affected by social distancing regulations, such as tourism and hospitality, particularly young women, particularly Black and minority ethnic women. There will be obviously variations by sector, but I think that that's a crisis that we're right on the precipice of. And also, as I mentioned before, women were the majority of frontline workers. I won't leave this slide up for too long because I'm very conscious I don't have much time, but these are just some of the stories I was talking about that really gave a voice to some of these intersecting problems that I'm talking about. And they showed over and over again this impact of additional pressure, children at home not knowing what's happening, a lack of support, social security that wasn't meeting basic needs, and the kind of impact that has for women's mental well-being. But women talking about having to make decisions about leaving jobs because they just didn't know what was going to happen once furlough or lockdown came to an end, what would be replacing it. So my concerns are numerous, but I think these are just three for the purposes of this discussion. The response can't be austerity 2.0. There isn't anything left from women's incomes to cut, quite frankly. If we're looking at investing our way out of this crisis, we can't just invest in the usual suspects. If we resort to a programme of house building, that's going to be men's jobs predominantly over women's jobs. So how can we make sure that investment is equally distributed? And just that point again about particular groups of women being employed in particular sectors, being more reliant on social security, and the impacts of well-being, impacts of isolation for their physical and mental well-being. Russell talked a lot about the responses already, so I wasn't going to spend too much time on this, but these were just a few of the things I wanted to raise in the context of gender and social security. So that £20 top up will not cover even the basic needs after 5 years of the benefit freeze. CPAG released survey data that showed that 60,000 more families are likely to be affected by the 2-child limit. And I think that's kind of a human rights abuse waiting to happen. Furlough, as I mentioned, has kind of protected the edges of that employment figure, but furlough was never designed to respond to childcare needs. It was belatedly extended to cover women or cover people who needed to take time off from work for care and childcare purposes, but it was never designed with that in mind. And I think it's fair to say that the replacement that we're about to see hasn't been either. And if women are having to take time off to look after children who are forced to isolate because they're back in school and the whole year group is affected, how's that going to play out even as we're not in a kind of national lockdown? Or even this morning, the discussion about local furlough, how's that going to affect women who might have to take time off for 2 weeks multiple times over the next couple of years? The Scottish Government's responses, again, I won't spend too long on this and we can definitely return to it in the questions, but I think there are serious questions about how Social Security Scotland can deliver against its ambitions, knowing that we're going to see a lot of new people exposed to the UK social security system, but also the kind of financial pressures that we're going to see placed on the Scottish Government. So how can it use the powers that it has effectively to meet the needs of specific groups is, I think, going to be the defining question for the Scottish Government's social security response. Women are more likely to be affected by delays to new entitlements. Women are 55% of PIP recipients, for example. Women are 69% of recipients of carers allowance. So the delays to disability assistance and new care forms of carers assistance are really going to be affecting women, not just now, but for years to come. The point I've made at the end about suspensions of evictions for renters, I just wanted to note that women are much more likely to rent than own property than men. Women also spend a huge amount more than men on rent in the private sector. So 55% of women's income, this is in England, we don't have figures for Scotland, but there's no reason to assume it's vastly different. 55% of women's income goes on rent versus 36% of men's income. So there's really kind of a gender dynamic to where we've offered support for people with mortgages over the types of support we've offered to renters. I'll just finish by saying these are kind of the challenges I think we need to bear in mind as we have discussions going forward about, it's, as Russell said, it's not just social security. There has to be a joined up, coherent response that understands all of the different aspects I was mentioning when it comes to women's experiences of COVID. We've got current reforms to social care on the table, planned expansions of funded childcare. How's that going to interact with women's ability not only to be employed in those sectors as the majority of the workforce, but to utilise those sectors as infrastructure in order for them to take on other forms of paid work? What changes do we need to see at UK level? And I've listed the ones that are kind of the most obvious to me, but there were many, many more I think we need to discuss. But also, how do we mitigate or respond to some of the gaps within the powers we have in Scotland? So I'll leave that there. I'm happy to put the slides back up if anyone wants to return to some of these challenges, but otherwise I'll look forward to the questions.
Thank you very much, Eilidh. And as I say, people do keep posting your questions in the chat bar, and we'll either come back to them in the chat bar or in discussion afterwards. Move on now to Ruth Patrick. Ruth.
Yeah, thank you. I'm trying to be, oh, let's see, stop. There we are, so we can all see those, can't we? This weird, yeah. Yeah, thanks so much for inviting me to be here today. And it's like really great to hear from the previous speakers. I think what I'm going to do is like a little bit different, but hopefully that's like welcome, and it's what I was asked to do. So we'll see. But basically, I'm just going to spend like a little bit of time sharing some kind of early findings from the COVID Realities Project, which is a kind of national project. And it's important to say that the work that I'm kind of sharing is a kind of team effort, and it really involves probably first and foremost the parents and carers that are working with us on the project, but also the research team, which includes like Kaylee Garthwaite, Jeff Page and Maddie Power. And we're also working in partnership with Child Poverty Action Group, the UK lot in Westminster. So rather. Okay, so what I wanted to say just to start with is kind of just going back to the context, because I'm kind of talking to the research and why did we think it was important to focus particularly on kind of families living with dependent children during this time. And I think when we go back, and probably none of us really want to or can bear to, but if we think back to what was happening in kind of March, early April, there was a really strong kind of rhetoric coming out about, you know, we're all in it together, we're all in the same boat, we're going to go through this kind of very dramatic crisis, but it's going to be together. But what was clear to a lot of us, and probably all of us here today, is that actually that crisis was going to be experienced in very different ways depending on people's kind of social and economic positions. And so it was really important to kind of make sure that there was a focus particularly on kind of families living on a low income with dependent children. And the importance within that, and I guess that's kind of why we're here today for this conference, about engaging quite critically and carefully with the social security response that was inevitably going to come through. But within that, and underpinning all of that, a kind of recognition that for any research in this area to work, it would be really important to actually make sure that it was engaging directly and drawing on the expertise that comes from direct experience, and making sure that those voices and experiences were actually trying to be included in the policy making discussions and debates, and that was a really kind of important thing to try and do. So that kind of led to like many late nights, and to the application of application for funding to the Nuffield Foundation that was ultimately successful. And what we committed to do was an 18-month research project, and we're about 5 months into that now. And the research project had like several strands to it, and they included kind of creating space and for researchers on poverty to explore how they adjust their work to new contexts. So that was about kind of collaboration, and not just trying to say, oh, you know, we're doing this and it's really valuable, but actually looking at connecting across different third sector organisations, different academics, saying let's bring the work we're doing together, let's see if there's common things coming through that. But also we're working with the English Child Poverty Action Group to look at tracking the social security response, and that's drawing on their early warning system, which was obviously pioneered up in Scotland as well. But we're also, and this is what I'm talking about today, we've also been doing some new primarily online participatory work with parents and carers on the low income, and that's what I wanted to share the findings of with you today. And that's the thing about that is that and what I'm sharing today is it's really exploratory, so this is, you're kind of getting a bit of a sneak preview and a rough and ready account, but what we've been doing with parents and carers is we've tried to create a kind of safe online space where people can get involved and document and share their experiences of living through COVID at this time, having dependent children, being on a low income. And people can get involved by kind of contributing to an online diary that they can add to as and when they want to. But they can also, every week we post online video entries that are kind of, we call them big questions of the week, and then people can respond to those either using a video, but also just typing as well. But importantly, we've also got monthly big ideas groups where parents and carers can get together on a Zoom like this, and we just have discussions about what needs to change policy wise and why. And what's important is that parents can do as much or as little as they want. So some parents are kind of logging on very occasionally, but other people are using the diary almost every day to share their experiences. So what I wanted to do is I just wanted to talk through let me just see, oh sorry, I've just gone back. Oh no, it's gone the wrong way. Previous, just that again, previous. Yes, I wanted to share with you some early findings from the research. And I think the first thing to say really is about the kind of context, and that I think that this is one of the reasons, and I think Russell made the point in his presentation, that families and children has been a kind of missing piece in the governmental response. I think both at Westminster but in the Scottish Government as well, that the families with dependent children have been facing rapidly rising costs due to the new context, and that hasn't been kind of properly accounted for or addressed by the response. So we've got these quotes here. So the first is from Nellie, who's a parent of two living in Yorkshire, and she talks about how she's already seen my food bills rise due to COVID. And I think one of the things that was difficult for parents and carers is the fact that they have these very well established ways for getting by and managing on a low income, but those strategies were put immediately under threat by the kind of realities of the situation that they found themselves in, and that made it difficult. And again, just a similar on similar kind of strands, Zara saying how coronavirus hit, she was extremely worried as to how it would affect my already fragile financial situation. And she goes on to say she's trying to remain positive or I would drown. So that context really informing everything that sort of happened next, and a context that seemed to be sometimes being forgotten in the government response. Okay, so this is perhaps I don't know, well, hopefully it's not like that controversial a point, but it's maybe a slightly controversial point, that the changes that were made to social security, particularly looking at the Westminster level, they were welcome, but it's like important not to overstate how valuable they were. And so thinking specifically about the £20 uplift to universal credit, very welcome, but also it didn't fully address, as none of us would, I suppose, expect it to, the kind of everyday lived realities of kind of poverty for a lot of the parents we were speaking to. So Victoria B talks about even the 20 quid, I'm worse off because of debt. It does now, the £20 is null and void, gone before it arrives. I appreciate that wouldn't be a campaigning message we'd want to use in trying to kind of defend the keeping the £20 uplift, but I think it's important to recognise that it hasn't in any way really addressed some of the kind of endemic problems with the social security system. Different but kind of similar point from Nellie K about the removal of the minimum income floor, or the change to that is vital to us, but it's a huge unknown. And I think I won't read out the whole quote because of time, but the kind of recognising that there's a kind of climate of uncertainty for families, and that's not necessarily been helped, I think, with a lot of the kind of communications that have been coming from government. And so people, while they are sometimes grateful for the additional support, they're just terrified about when it might go and the consequences that might have. Linked to this, and again, I'm not going to read these all out because of time, but you can read them as I speak to them. The problems around deductions in the 5-week wait for universal credit. So seeing those kind of design problems with the social security system that weren't addressed before the pandemic, haven't been addressed during the pandemic, and then making people's lives especially different. And it links a little bit to a point Russ was making as well about public attitudes. Might public attitudes change? So in this case we have Roxy, who's a new universal credit claimant, and experiencing those difficulties of having the 5-week wait for the benefit. And just she talks about it here in her diary entry in detail, how she's currently looking at getting £1,100 in a month, but she needs 1,700. And actually I think she talks about her living money there is £600 ish for food, pets and cigs, and but also like blaming, saying already kind of anticipating the criticism of why are you spending your money on cigarettes, but then you're saying I'm actually, life's quite stressful at the moment, I need the cigarettes, which I think we can all understand, but showing those kind of really deep rooted negative narratives around people on benefits and living in poverty. So the next one, just around the kind of endemic stigma around benefits. Obviously in Scotland you're doing a lot better than the Westminster government about trying to talk about social security in terms of dignity and respect, but I think there's still obviously problems around benefit stigma. And here we have Alex, who's a single parent to a disabled daughter living in Scotland, and she just talks about some problems with the kind of free school meals, and how Aberdeenshire Council apparently struggled because of Eat Out to help out, and then they organised a special system where pupils who are on free school meals leave class earlier to access it, but she says the stigma allowed bullies to use in for free school lunches to torment. So real problems still around those kind of stigmatising issues. And then accessing additional support. So again, I think this is something that maybe both presentations touched on, the kind of additional support through in England we have local welfare assistance, you've got Scottish Welfare Fund, but just the process of sometimes having to try and request that money not being nice. So Teddy, who's a single parent from Northern Ireland, talks about that process and says that it's humiliating and degrading and makes you feel like you have to justify your existence to a stranger. So these are kind of narratives that we've seen about social security receipt for many years, but they're still coming in the kind of particular pandemic responses. A very quick note on conditionality, just to say that for many the pause to conditionality was very welcome. So Holly said, the best thing about COVID is that I have a few more weeks but I have to search for work. So she was really thankful for the kind of breathing space that it provided to have a reach conditionality, but also the return of conditionality causing a lot of problems for people. And I think also having quite difficult communications about conditionality. So people, because they were still required to kind of engage with the online journal system through universal credit, not being clear about what expectations were. And Victoria B, who, linking to Eilidh's presentation, was a survivor of domestic violence. She talks about the return of conditionality and saying, now I have to be the obedient pup and jump through the hoops, apply to jobs who don't take me, send out CVs to organise that might have people my ex knows who may recognise my name, risking my whole family just so I can say I tried but no interviews yet, etc. So I think that feeling of the futility of conditionality, which arguably is even more kind of apparent in a context where there aren't very many jobs, being experienced in quite negative ways by the participants. Another one for me around problems with kind of those relationships between people in receipt of social security and advisors, and I think again just a failure sometimes by advisors and by the system to recognise what you're asking of people and to be kind of to have those principles of dignity and respect underpinning those encounters. So here we have Charlotte P, who's a single parent living in Northern Ireland, and she's talking about having a telephone interview from a medical professional connected to universal credit, and it says, like in the letter, it specifically stated that it was to be limited background noise. And I think that in itself, in a kind of context of COVID, when many of us are we've got children at home, it's a really kind of problematic request. But she goes on to talk about how she was really worried about that. She was then trying to get her son cared for by his father, who was her ex-partner and who had been violent towards her. But then in fact, like the interview didn't happen, she had to be rescheduled, so she went through all that anxiety and worry, but it was unnecessary. And I think obviously appointments get cancelled, but being really mindful of how do these encounters have to take place and how can we do them in ways that are experienced as more supportive, and that not always happening. So I'm done. I can't quite work out. I think I'm doing all right for time, but nearly I'm done anyway. So I think the thing as well, and I think we've all seen this, and there's been lots of kind of coverage of this, but just the kind of the failure of the social security system, I guess, that I think John was talking about in the introduction, that's kind of been, we knew about already, but it's been further exposed by the pandemic, is very much evidence in the continued need and reliance for emergency charitable provision, which is kind of, you know, most highlighted, I guess, in the kind of continued expansion and existence of food banks. But those kind of negative experiences around making use of emergency food provision, which I think we have to always remember and always highlight. So Holly, who's a single parent, talked about an experience here about getting some kind of emergency food boxes that contained, I guess they were kind of using you know, food waste that had been provided by supermarkets, and some of the produce was out of date and inedible. And she talks about that sort of humiliating and degrading experience of kind of opening and you know, receiving produce that was kind of out of date. And she says, you know, I know beggars can't be choosers, but 4 loaves of inedible bread was an emotional blow at the time. So a really kind of difficult and negative experience. And then Victoria B just talking, you know, hopelessness bites. I've got no money again until the end of the month. The food parcels we get are making me feel sick. All these high salt tin goods are giving me headaches in the runs. So just having that difficult experience of being in living in poverty and having to rely on food bank for parcel receipts. So just you know, before summing up, I think just kind of recognizing, and you know, it's be familiar, it won't be a surprise to any of you, but the difficulty around the kind of the holes in existing provisions. So Ted there, who's an unemployed single parent living in the northeast of England, just talking about, you know, he'd followed the guidelines, he was self-employed, he claimed universal credit, but he feels like he's worse off, he's in debt, he's got no money, and that impacting on his relationship with his children. He's trying to, you know, his children think his dad is Superman, so he's trying to conceal that anxiety and worry that he's feeling about his financial situation. Similarly, Lola, a single parent of 2 children, who's kind of a key worker as a school cleaner, and just struggling, that kind of financial struggle, you know, day-to-day living, and kind of very little food, and constantly being threatened by my housing officer with losing my home due to getting into rent arrears. So really sort of difficult everyday experiences. Okay, so just to conclude really quickly on that, I think, you know, a key point that I guess I was making there around the £20 universal credit uplift, that it's not always or even often made the decisive difference to the everyday hardship experienced by families living with dependent children in poverty. There's much more we need to do there if we're going to really address and tackle poverty. And then I think the fact that the processes of receiving support across the crisis are still often being imbued with kind of feelings of stigma and shame, and you know, we would expect that, but it's important to note that it's still there. Structural issues with universal credit very much remain. You know, wider issues, you know, Eilidh touched on the 2-child limit, the benefit cap, the fact that those persist is really problematic. And I think we also need to monitor the return of conditionality really closely. Like a final point, just, you know, the importance of engaging with and drawing on the lived experiences and the ideas as well from people with direct experience of poverty of what needs to change. There's kind of quite a lot of conversations at the moment, you know, about, you know, how we build back better. And it's really important that we make sure that those conversations are inclusive of all forms of expertise, including lived experience. That's it for me.
Thank you very much, Ruth. I think you'll agree, 3 really useful interventions there, contributions. It's now open to all of you to put your questions, but not just questions, your thoughts and reflections on how social security system has coped over the last few months, but more importantly, actually, thoughts on what priorities for change should be going forward, building on some of those ideas that we've already heard. We've already had a few areas of questions coming up in the question bar. One thing that's sort of been coming up there has been around the issue of stigma, and also the difficulties many people actually have accessing benefits in the first place, but then when the response to that, too often reinforcing the stigma by trying to tailor support to particular groups. I just wondered whether panelists had anything more to say around how we can remove both barriers to accessing benefits at the same time as tackling the stigma too often associated with the support we provide, as well as with the system itself, I don't know whether this picks up on some of your points, Russell, about how we actually define social security, and perhaps broadening the definition might be part of the answer here. Russell.
Yeah, I thought, so I'm sure Ruth and Eilidh will have lots to say, and I should have said, I didn't really have time to, but we've used direct experience work through the Rethinking Social Security project and some of the stuff that we've done on social security before, and I have to say it is just some of the most powerful research I think we've ever done, and certainly powerful in terms of personally. But just beyond that, so in terms of stigma, so I think there's 2 or 3 things to say. One would be, I think we've had a real, well, there's been some really good things about using the local level to get support to people quickly during the crisis, but there have also been some bad things, and I think you can see some patchiness across the 32 local authorities using the welfare funds. We've certainly heard reports of pretty poor behaviour from the system in terms of dealing with claimants, and I think Ruth, you had one of the quotes pretty much spot on that, you know, just feeling completely disempowered and stigmatized by even applying for help in crisis. So hence looking really quickly at whether we should use that local level or not as we get through the rest of the crisis, and if so, and I guess it probably is a yes, at least to some extent, how do we ensure that those good principles around dignity and human rights and respect flow not just from the agency but from the local authorities too? Beyond that, I think yes, there, you know, definitions, like I said, you know, we seem to define the cash payments we give, and this is a bit blunt, but the cash payments we give to middle class people is not social security, and the cash payments we give to people on low incomes or in certain population groups as social security. And whilst we're doing our best in Scotland to get past some of the stigma around what has been called welfare or benefits, and I think that's really good, you know, there's bigger steps we can take, and bringing more and more people into what is a social security system, I think would be a good step towards it. I'll stop there because I could yabber on for the rest of the time.
Thanks very much, Russell. I wonder if that brings in Ruth then, in terms of drawing on your work, drawing out the lived experience, whether anything coming out of that work that would help to identify ways of reducing stigma at the same time as ensuring we are reaching those who most need support from the social security system.
Yeah, I think it's a really big, I think it's like recognizing the scale of the challenge as well. So I think one of the things that I didn't have kind of time to touch on was how people that were living in poverty that we were speaking to felt excluded from the broader narrative. So I think, you know, the kind of discussion about, oh, come on, like, I mean, mainly from Boris Johnson, I guess, in England, you know, it's time to get out, do the things that you enjoy again, or eat out to help out. We had quite a lot of diary entries from people saying, you know, this just means nothing, you know, there's no way I can do these things. And so feeling quite a sense of disconnect from the kind of their everyday conversation, I think kind of then made things more difficult. So I think, you know, asking our political leaders to be more mindful of the diversity of experience. So when they make these kind of, you know, kind of grandstanding speeches about this is what, you know, being recognizing those different forms, I think it links into what Eli was saying as well, as about the kind of the gendered thing, you know, like, you know, we're not all going back to work. Some of us are you know, at home caring for children. That's valuable. So, you know, like bringing people into that national discourse is, I think, important. And then just as service providers, just being as mindful as we possibly can about, you know, our communications, particularly, I think. So the example of Charlotte, you know, getting that letter, which, you know, probably was a standard letter saying, you know, you've got this important assessment over the phone, you know, you've got to be really careful that you don't you know, there isn't any background noise. These are letters that have a lot of power underpinning them because people want that entitlement. And so I think you know, it's less about stigma but about relational stuff. But if you can try and address some of that, I think in the communications, it's important as well. And I think the Scottish, you know, Social Security Agency has worked quite hard on that. I don't know what the progress report is on how they're doing, but you know, those things really do matter, don't they? The small things.
I don't know, Eilidh, whether you would have anything to add on that, and particularly maybe picking up on that, whether the experience in Scotland has been any different with the Social Security Scotland agency.
Yeah, I mean, it is hard to put a figure on that. 88% of applicants to Social Security Scotland are actually women, and that's not surprising because of the propensity of Best Start grants and the funeral support that are kind of the direct application. We would expect women to be applying for those more than men. But I think women have kind of been absent from the conversation about whether that system works for them. Social Security Scotland wasn't even collecting that data until 6 months ago, so it's hard to measure. On the kind of communications point, I agree entirely, but I think we shouldn't put too much of an emphasis on that. And the example I would use is we've seen a lot of conversation about the need to recognise unpaid care and the contribution that unpaid carers have made, and the ways in which unpaid care has been so visible over the last 6 months. And actually, we haven't really seen any attempt to increase carers allowance. We've had the additional supplement that was paid in June in Scotland. I haven't seen much conversation about how we can make that more permanent. Carers assistance, as I said, the consultation on that has been pushed back even further. So I think there's a change in Scotland, but I think there's still a lot more to do to translate that into actual action to make sure we're meeting the groups that you talked about.
Thanks, Eilidh. We've got a specific question here, I suppose firstly at Russell, around the minimum income guarantee and whether you'd be able to expand a bit on how that might work in practice and what the implications might be for tackling intra-household risks. So I'll go to Russell first, but Ruth and Eilidh may want to add to this as well.
Yeah, I'm sure Eilidh would almost be in a much better position to answer, but I'll go first, and then Eilidh, you can improve in terms of my response. I put something in the chat box on it. So a minimum income guarantee is, there's many different definitions or concepts for it. What we're thinking through is whether you could get to a targeted payment set at the minimum income standard. So that's there's been a lot of work to understand what different families need to have a good quality of life in terms of income. Set at that level, that would have no conditions, no sanctions, no work requirements, no assessments other than being of a sufficient income to qualify for it. So it's targeted, it is means tested, but beyond that, all of the pernicious stuff from universal credit is taken away. What that doesn't answer is Marilyn's question around intra-households. So you've got a problem, of course, whenever you're assessing at a household level in terms of people's income, there are intra-household dynamics you're not going to pick up on there, whether that be around abuse or whether that be around power and everything in between. Secondly, so you could pay it individually rather than households, or if you pay it household, you could add a proper primary carer test or allow split payments that mean hopefully you can begin to tackle some of the gender dynamics within households. But that's maybe a bit too waffly. Eilidh, I'm sure you could come in with a much better answer. But sorry, just to finish, we're doing some thinking on this. Rachel, my colleague, and I hope to do some direct experience work on it. And so if anyone's got ideas around that or concerns around that, it'd be great to talk beyond this workshop.
So we haven't at Engender, we haven't done any specific work on a minimum income guarantee, although it's becoming more common in these conversations as an idea. The challenge is, I think, with assessing that intra-household conversation, we collect so much data at household level. It's really, really hard to do kind of quantitative estimates of what that would look like. The link between individual need and individual entitlement is one of the key elements of universal credit that I think is broken. When universal credit combined the 6 different entitlements that it did, what it did was pretend that those no longer existed. And that's one of the challenges with actually introducing separate payments, is that it's a bit like Schrodinger's cat. Like it exists, but it doesn't exist because there's just this final number. So that link between entitlement and need is completely broken, and I think restoring that would be a really important first step before we could understand the impacts of a minimum income guarantee for both parties in a household payment. Doesn't really answer your question, but I would be very interested to be part of Russell's conversations about this.
At this stage, Ruth, if you would have anything to add to that, expanding on the idea of the minimum income guarantee, or
I think like you've got other questions. I mean, I think the only thing to say there is that these kind of it's really important to have those like solution orientated kind of conversations, and actually bringing in, like, so exactly, Russell, what you're saying about bringing in direct experience. So that's one of the things that we're keen to do, and like keen to collaborate with people on, so that there is opportunities there to kind of, because I think often you can kind of, it's like when we look at universal credit and the design, some of those really endemic design problems around, say, you know, many places still not having access to split payments, direct payments. If you talk to people with direct experience from the beginning, people would have been told that those are bad ideas, they're not going to work. So I think bringing in that expertise can help us develop better solutions and ideas. So yeah.
Got an interesting question here that kind of turns things around a little bit and talks about we're talking about how Social Security has responded to the pandemic, and the kind of, but also what the role of Social Security might actually be in terms of stopping the spread of the virus. And I suppose I'm then thinking not just this virus, but clearly these are things that are likely to happen again in the future. What role does Social Security have to play in terms of that kind of public health impact, or how can it be used to stop the spread of these kind of viruses? Bruce can come. Yep.
No, I was just going to say, I think it's a really great question, and I think it actually links in some of the other things that we're talking about. And I can see in the chat, Martin Johnson was raising that point about the NHS. It's actually seen Social Security as an asset that actually can help us respond to like new and difficult times, and it's reframing, you know, reframe the whole, you know, area, I suppose. And I just totally agree that actually you know, Social Security should be a key tool for all of us, and for you know, the whole of Great Britain, I suppose, in how we respond to and live it through difficult times. But the fact that it's been so completely undone and dismantled, and, you know, means that, you know, just getting to that point feels a long way away, but maybe starting to talk about it more in those ways is a really helpful way to go. And just on that, I think we saw, you know, we've got this kind of new Westminster payment for if you're kind of having to self-isolate, but when you look at that payment, the holes, you know, the payment isn't, you know, there's so many conditions attached to getting that payment. So it's an example where, you know, there's a kind of direct response to the kind of the needs of the virus, but it's poorly designed. It's going to be very difficult to implement, and it's going to make it unworkable in terms of a kind of public health response.
Yeah, and I was just going to say, I think, you know, there's been a lot of talk about different countries and their approaches to the virus, and Sweden has come up often. And often, actually, it's sort of people that, dare I say it, are on the right wing who look at Sweden as a sort of place with less restrictions and a bit more of a normal life, and letting the virus go a bit further than lockdowns allowed to. But what those people completely miss is that Sweden has a really extensive social security system that allows people to self-isolate properly, for example. It allows people to make those choices that everybody would, if they could, around protecting other people and around minimising the virus. Here, you know, sick pay is another one where we came into the crisis completely and utterly having dismantled that sort of part of the system, and then scrabbled around at the UK level to try and improve it. And even now, with that £500 payment, or with the small changes to universal credit, people who have to self-isolate are going to be having to make huge financial hits. And if you don't have the money, how on earth can you do that? So yeah, I think it's a really good point that you know, spinning it a bit like key workers, a bit like care, a bit like health more broadly. These are really undervalued parts of our society that we've had to value, and we've in essence got us through this so far. Social Security should be, and probably is, and has been, another one that's got us through this so far as it has.
Did you want to come in on this at all?
I will just say that I had sick pay on my list of things that the UK government had done, and I didn't really get a chance to dig into it. But I've got the figure here. Yes, 20% of workers were ineligible for sick pay, and 70% of those were women. And I haven't seen any change in that since April. I'd be interested if anyone else knows of that. But clearly, the threshold for sick pay isn't working, and if we're talking about children being back in schools, and the very real risk that whole classes will have to self-isolate multiple times a year, or the women who are more likely to be working on front lines and be exposed to the virus. I know we have more PPE than we did, but I'm really concerned about the ways in which that will impact women's ability to stay in the labour market long term. And social security is one response, but I think putting too much emphasis on social security as a response might have some adverse consequences. So I caution a little bit there.
Thank you. I'm aware we've only got 5 minutes left. There was a kind of question that came up at the beginning from several people around public attitudes and the extent, I suppose, which we needed to change public attitudes as opposed to get political buy-in from the policymakers and the politicians for the kinds of changes to social security, and a question around whether there was any evidence of a shift in public attitudes as a result of the pandemic that might help to support the climate in which the kind of changes we've been discussing might be achieved. I don't know who would want to come in on this first.
I can, but I feel, more than happy to, but more than happy for anyone else to. But I think, Ruth, you asked it whilst I was presenting, so it's only fair, I think, that you don't have to answer your own question first. But yeah, I think there is some evidence of, firstly, pre-pandemic, there being a distinction in Scotland to the rest of the UK. So slightly more support for higher taxes and higher social security spend. Equally, there's been some evidence of a shift across the UK over time, as even pre-COVID, as the cuts and the austerity have become much more obvious to everyone. Sure enough, people begin to value the things that have been taken away. Now, through the pandemic, obviously the data isn't there yet, but you heard some sort of qualitative data from Ruth, and similarly, you can see it around you in terms of that sense of community and that sense of solidarity, which I don't think is fully diminished. It does feel less than in April, but maybe it hasn't gone away completely. So that public opinion, there's some positives there, there's some hope there. I think, Ruth, implicit in your question is, politicians also need to lead, and I think that's absolutely right. I think in Scotland there is a bit of that leadership happening. I wouldn't want to overplay it. I think you could push farther than the Scottish Government have, but at the UK level, I don't see that leadership. And how do you push that last question? How do you get vote? How do you get voters to vote for this stuff? Is a question that we too often sort of skip over because we know what's right and we know what's wrong. But actually, unless we get voters to vote for this, it won't happen. So I think there's some hope there that public opinion is shifting anyway, but we need to, all of us as organisations need to push it further, particularly over this next 6-7 months in advance of Holyrood elections.
I'll turn to Eilidh. I suppose just something to add is whether there's something to learn from the experience up to 2010, where we actually saw a significant political leadership and money put into social security through maybe imperfectly through the tax credit system, with positive impacts in terms of falling levels of child poverty, but how quickly all that was then swept away in the following 10 years because I think the public hadn't, or voters over the whole hadn't bought into the agenda in the way that we need to see happen. And how do we learn from that and ensure that any future success on reinvestment in social security isn't vulnerable to change in political context later on. On that, I'll turn to Eilidh for the last word on this.
Gosh, I think you can't answer that question without returning to the very design of universal credit, which was all about, it was a political agenda about maintaining a single homogenous family unit that was quite gendered and quite, I think, outdated even by 2010 standards, and that's exactly the analysis that we applied to the single household payment. It's all about this idea that somebody in the household, normally a man, goes out to work, brings home an income, it's divided by the man for purposes for use in the household, and the woman spends it on doing the food shop. It's this very gendered way of looking at money. And I think that's kind of been normalised as we've gone on, and universal credit has been rolled out increasingly. I do wonder. I also think you can see that in some of the opinion polling about universal credit, and the two-child limit has proven to be quite popular. People seem to quite like the two-child limit, even though many of us, I think, would see it as an affront to women's rights. So I think there's a leadership role that the design of the system has to play, and disrupting that normalisation. But I do wonder if now that we're seeing more people who probably never expected to be reliant on social security, who would never have foreseen their circumstances change to that degree, it kind of demonstrates the ridiculousness of the system, particularly when it comes to the two-child limit. If you couldn't predict a pandemic, how can you apply that logic to anybody else? So I think the design is key, but I wonder now if we'll have more people questioning that design, which is a sad but possibly a good outcome for a really depressing and terrible situation.
I think that's a good point at which to end. We're out of time. Really just to thank all our speakers for your contributions. I've certainly found it hugely thought-provoking and informative, both the kind of getting this mixture in the discussion we've had of long-term vision, fundamental change of how we see social security, but also trying to look at under short-term changes that can be made that can make a real difference. This discussion will feed into Poverty Alliance's prioritisation of asks and calls in the run-up to the Scottish elections. Clearly in an hour and a quarter we've only been able to scratch the surface. I think the offer is very much open there to continue to feed into ideas to keep this discussion going, and I'm sure there'll be other forums which will be able to do that. And I see the speakers, at least some of the speakers have already said, please do get in touch with them directly to keep up some of the conversation and feed into your thoughts the various strands of work that are going on. So on that note, really just to thank all of you who are out there and who hopefully managed to cover some of the questions and comments that people were putting in. Thank you for participating, and a big virtual round of applause to our 3 speakers for their contribution. Thank you very much, everyone. And just to say, to clock back into the main conference when this finishes. So thank you.
Thanks, everyone. Bye.